Hello and welcome to another edition of Meet Your City. I'm Heath Covey, and joining me today is Joe Scislowicz, the Director of the Chesapeake Integrated Behavioral Health Care. Joe, welcome to the show.
Thank you, Heath. Appreciate being here.
Tell us first just a little bit about your background, what brought you to Chesapeake and how you got into this role.
Well, I've been working in behavioral health probably for about 42 years.
And started when you were 6 years old.
I was a child, a mere child at the time. And I came to Virginia directly from graduate school. I worked in Petersburg for a while, and then before I came to Chesapeake, I was the clinical director for Western Tidewater Community Services Board. Okay. And this is a great opportunity. I always liked Chesapeake. It's a well-run city. That's one of the things that attracted me coming here. And I knew a couple of the staff that worked here, and I just checked it out and decided this was a good place for me. It has been for the last 12 years. 12
years you've been in Chesapeake? Okay. All right, so let's start by dissecting the name. Your department has one of the bigger names, Chesapeake Integrated Behavioral Health Care. So obviously you serve Chesapeake. Are you focused only on serving the city of Chesapeake and their residents?
That's our first priority. It's interesting with behavioral health and healthcare in general. Some of the things that guide us are external to the city. Like, for example, if you have a third-party payer, you can't discriminate against a third-party payer. For example, Medicaid. Medicaid is a statewide program. People can go anywhere they want to, but they tend to cluster in the areas they live. So we have very few people from outside, but we do have a few.
So if somebody lived close to the border or something and it was more convenient to come to Chesapeake, you would not turn them away or anything?
That's correct. Okay. And we would also help coordinate care with their local community services boards and be able to assist them in transitioning if they want to.
Okay. All right, so integrated is in your name. Tell me about what do you integrate?
Well, I love that idea. When we talked about changing our name, Community Services Board, when you hear that, what you think of is a lot of different things. You think of community, you think of services, you think of a board. Well, first of all, the board is the governance.
Okay.
So we said, the first thing we want to do is make sure we don't mention that, because that really doesn't have anything to do with service delivery.
Right. It almost sounds like you have to go before a board.
That's exactly right. And it's confusing. We had a lot of people requesting a whole lot of services that had nothing to do with us. So I met with my board of directors who are appointed by the city council, and what we said was, what can we do to describe our services better? And the first word that came up was integrated. What does integrated mean? Why the word integrated? Well, there's a couple different reasons. One is we want to make sure that citizens know that we're integrated with other departments in the city.
I see.
We do as much as we can with and if you name a department, we usually have a program affiliated with it. That's important. Second of all, we believe in whole person treatment. Whole person treatment simply means that years back when I started, you had folks who provided mental health services, you had people who provided substance use services, you had people that provided developmental disabilities, and you had people that provided physical health care. Well, we recognize that we have to integrate all those services in order to provide the best care for people.
Because people don't have just one issue.
That's exactly right. And you have to treat the whole person, and it doesn't mean we crank everything on everybody, but we have to recognize that the whole person is affected by the sum of the parts.
Okay. Now, behavioral is in your name.
Right.
Is that, I know you just kind of described sort of the program areas, but what sort of behavior? Are we talking about like anger issues? Or are we talking about, broader type issues?
Yeah, the key for us is as the public provider for behavioral health care. Behavioral health care, we chose to use that title because it encompasses mental health issues, it encompasses substance use, it encompasses developmental disabilities, and other things. So we have a broad context in which it's sort of a term of art right now. If you look across the state, I know one of the things that I wanted to make sure people understand, we are a community services board. But again, like the name, a community services board is an entity developed by the General Assembly to sort of group all these services together.
Okay.
And most people outside of government don't know what that is.
Right.
So we decided to go with a name that was more encompassing of what we did, who we served, and the philosophy we had.
And I gather more obvious to the people who need your services.
Correct.
Who to come to.
Correct.
Now, you do have health care in your name. Do you do medical type care? Or
well, it's interesting. You can't separate mental health care, behavioral health care, from physical health care. We do not provide physical health care per se, but we do a lot of care coordination. And that's important because many of the behavioral health issues we have physical components and may mimic them. So one of our big jobs is making sure that we have contact with the people that provide physical health care for the individual and help integrate it.
Okay. I know you mentioned that you do substance abuse as one of the things. I mean, what little I know about that is, you can't have someone who has a substance abuse issue. They typically are going to have some physical issues as well.
Correct.
So you work with their doctors and those
Correct.
folks as well.
And the thing is many people today, although with Medicaid expansion it's really helped a lot of people don't have health care as such. So what we do is try to help them coordinate an opportunity to get health care.
Okay. Of the service areas that you cover, what's the biggest? Where do you see the most people, or have the most, for lack of a better term, the most business?
We have most of them are under the title of mental health care. Second, substance abuse. Third is developmental disabilities, which is intellectual disability, autism, that sort of thing.
Has that pretty much in the 12 years or so you've been here, has that stayed stable, or are you seeing? I know we're hearing a lot about things like opioid addiction. Is substance abuse rising and may overtake, or do you think that's?
No, I don't think so. I think what it is because you have to treat the whole person. A lot of folks with substance use disorders have behavioral health issues.
I see.
A lot of folks we're seeing with opiate addictions come in because they had a physical health care problem that were treated by a physician who prescribed opiates and then maybe didn't taper them off appropriately, or did not work with them in that way. So we try to address those issues best we can.
I see. You talked about working with the other departments. I'm sure you work very closely with Human Services, but tell us a little bit about some of the ways that you work with, do you work with the sheriff's office as well?
Oh yeah. We have worked over the last several years to do a number of innovative things with our criminal justice partners. We have worked with the Sheriff's Department and Police Department to establish a CIT assessment center and CIT training, crisis intervention training. It's a 40-hour training that police officers and sheriff's deputies go through to understand behavioral health issues better, and I mean the whole gamut. And 40 hours out of a police officer's time is a lot of time.
It is.
But that's paid benefits in terms of their ability to understand folks when they come into crisis situations with them, how to protect themselves better, and it really reduces the danger for them because they have better knowledge.
When they're on the street interacting with someone who has those, they know better how to handle that.
Exactly, and some of that's also tied into our increased funding for other types of services. For example, we started we had a drug court here in Chesapeake for a long time. When I got here, we had like 6 folks there in drug court, but we achieved other funding and did some restructuring. Now we have like 35 people we're seeing, and that's quite a bit. Then we have a behavioral health docket, which is important because we want to decrease the number of folks who are in the criminal justice system who have behavioral health difficulties, who can be treated better in another way. And
so this is a way to redirect those folks into a more proactive, positive outcome.
Exactly. And we just got funded with a grant from the Department of Behavioral Health that we're working with to assist with discharge planning from jails with people who have behavioral health difficulties in jail, because linking them to services and when they get out is a good way to reduce them going back into jail.
Not just dumping them on the street.
Exactly.
Making sure that they have a way to continue to progress after they get out.
Exactly.
Talk to me a little bit about the number. How many people do you serve in a
year?
In a year, let's say.
It's interesting. We have about 4,500 people we see, and those numbers, of course, have gradually gone up over the last 12 years that I've been here. A function of a couple of things. One is our outreach. We try to partner with as many different agencies as we can to make sure that people are aware of our services. I joked the other day at a panel discussion that we're one of the best kept secrets in Chesapeake, and having this opportunity to talk to you about services and getting out is what we need to do more of.
I think so. I would say, people talk about CIBH, but they really don't know what it is and how it works. Now, you said that community services boards and, of course, your office were created by the General Assembly. You guys are both a city and a state entity. Is that
Well,
true?
We're a city entity. We get funding from 3 areas. The city is where we have our predominant loyalty. The city funds us for about 30% of our budget. We get about 30% of our budget from state and federal entities and grants, and then we generate about 40% of our budget through fees.
And fees to the people you serve, or through insurance, or through Medicare?
Through insurance and self-pay.
Okay.
Most of it's insurance.
Okay. So insurance covers a great deal what you do as well.
But for folks, we don't turn folks away if they have an inability to pay. We have a structured system that allows us to do a sliding scale. If you go on the city's website and our subset of the website, it has the criteria for what people need to bring if they want to come in for an appointment. Okay. And we ask for proof of identification and proof of residency and some other financial information and family information, so we can help make that determination.
I see. So, but you won't turn somebody away?
No, we don't turn folks away.
That's terrific. What do you see as the biggest challenges going forward here for CIBH?
Well, one of the biggest things we had to deal with, and we're very fortunate that we have a progressive governor now who's continued to fund behavioral health. One of the things that we've done was to increase access to services. And that's always been a challenge for us. How do you get people in? And whenever you schedule things, it's, people don't show up.
Sure.
So we have one innovative program we're doing it for about 18 months, which is same-day access for services. And what that permits us to do is, if you walk in between 8:30 and 1:30, Monday through Friday, you will be seen.
Okay. And when you say walk in, where is that?
At 224 Great Bridge Boulevard.
Okay.
That's our main office and where we provide the majority of our clinical services.
Okay.
So, one of the challenges was, how do you get people into services relatively quickly and efficiently?
Right.
And we've successfully implemented that.
That's great.
The second thing I think that we're looking at is, anytime you have more people coming in, the next challenge is having to have sufficient staff to do what you need to do.
Right.
We've been very fortunate that we've had a consultant come in and help us realign some of our services so we can provide services more efficiently. So those are sort of and also finding qualified people to work. Mm-hmm. Over the last number of years, the criteria for provision of behavioral health services have gone up. So we've had to have higher qualified people, people who are licensed now, people who are under supervision for licensure, so that adds an administrative burden to us.
It kind of tightens up the pool.
It tightens up the pool, for sure. And we also compete. The economy's pretty good right now, so a lot of folks have opportunities to go other places and work. So
it sounds like tremendously worthwhile work, though.
Yeah,
what you do.
It's a lot of fun. There's been a lot of changes in the last 20 years for sure, and what we did 20 years ago isn't what we're doing today.
Right.
We're more business oriented, we're more focused on high quality clinical services, evidence-based practices, that sort of thing. Right. So I'm real excited about the future for us.
It sounds like by being more business focused allows you to be more service focused as well, because you can be much more efficient in that way.
Yeah, we certainly try.
That's great. That's great. Well, how can people learn more about it? They can call your office. They can go on the website.
And we'll list the phone on this, as well as the website. And we always have folks available. We have emergency services 24 hours a day, 365 days a year, both at our office and at our partnership with Chesapeake Regional Medical Center. Mm-hmm. We have our Bridges program there right off the ER. So we have access to services all the time for folks.
Terrific.
So, but anytime you can call our main number, and if anybody has any questions, they'll direct them to the right place, so we can do that.
Well, Joe, thank you so much for being here today, and kind of raising the curtain on the mystery of what is CIBH and what do you do. And that's what we've had for this time for Meet Your City. Hope you'll join us again next time when we'll be talking about another of the great departments here in the city of Chesapeake. Thanks for watching.